Welcome to Empower Her Radio, the space for powerhouse women ready to step into their next level of abundance, purpose, and personal freedom. I'm Dr. Corey Winn, a high performance coach, doctor of physical therapy, philanthropist, and business consultant. I help ambitious women align with their highest calling, expand their wealth and impact, and create a life that feels as good as it looks. If you're a high achieving woman who's built success yet finds yourself craving more alignment, more purpose, more ease, you're in the right place. Here, we bridge the gap between ambition and fulfillment. Through transformative conversations and proven strategies, you'll gain the courage to step into the fullest expression of you. Build a powerhouse business that aligns with your expertise and divine gifts, and lead your life, both personally and professionally, with unshakable confidence, worthiness, and compassion. This is about expansion, legacy, and owning your power unapologetically. You already have everything inside of you to create a life of unlimited possibility. It's time to unlock it. Welcome to your next level. Let's dive in. This episode of Empower Her Radio with Dr. Corey Winn is brought to you by Her Quantum Rise, the private coaching experience for the woman who refuses to play small. Her Quantum Rise is where high-achieving women come to elevate their leadership, align with their deepest purpose, and unlock overflow in every area of life. This is where you shed the old paradigm, step into your highest identity, and rise with clarity, certainty, and unstoppable momentum. If you are ready to move from doing it all to leading from grounded power, if you feel the pull toward a bigger life, a bigger mission, and a bigger capacity to receive, then I would love to explore what this next level looks like for you. Book a complimentary call at www.corywin.com/free call and step into the room where your expansion becomes inevitable. Your rise starts here. Today, we are joined by a woman whose story is the definition of turning pain into power. Dr. Cindy Trice is a veterinarian, a serial entrepreneur, cancer survivor, and the co-founder and chief innovation officer of KickIt Pajamas, a company reimagining what dignity, beauty, and comfort look like for women navigating cancer treatment. Cindy, welcome to the show.
Thank you so much for having me, Corey.
So we've chatted kind of off screen and before about how important your mission is to me. I have 5 women in my family who are cancer survivors, one of whom was my mom. But before we really get into that, I really want us to talk about your journey. Veterinarian, leader, entrepreneur, cancer survivor. Tell us how you got here.
Yeah, so I guess the cancer story, it seems very separate from being a veterinarian, right? And starting a clothing company. But in my mind, it's actually all mixed together a little bit because I was actually diagnosed with advanced stage cervical cancer only I was about 3 months in, 2 to 3 months into a veterinary internship program right after I had graduated from veterinary school. So I was a new veterinarian. I got this diagnosis, and so in my mind, it is very connected. Those things aren't compartmentalized to me. And I will also, just another thing that attaches those two things is, I'm as a veterinarian, I'm a healthcare provider, right? And I am, and there, I, I've learned over the years that dignity in healthcare and dignity in health is really important to me.
Yes.
And whether that has to do with helping a pet parent through navigating an illness with their pet, making sure that I'm advocating for the pet as well in their comfort, or whether it was my own journey as a cancer patient, or now I'm in elder care years of my life. And I have been advocating for my 94-year-old father, who has been in the healthcare system. So anyway, I feel like that's the common thread is
I love that.
dignity
And
and health.
having both of us be in healthcare and my foundation as well, dignity is of the utmost importance and is oftentimes the first thing that's lost.
Hmm.
I will never forget as a brand new PT, I was working with a lady who just had a hip replacement. And I said, if you don't mind, I just need to check your scar and your incision to make sure that it's healing okay. And she just dropped her pants in the middle of the PT office. And I was just like, what? And she said, oh, honey, all my dignity and modesty was lost a long time ago. And I thought, oh, why? Why?
Hmm. Yeah.
So I love that. That's so close to my heart.
Yeah. Yeah, and that is, I mean, that's true because I have heard myself say those same words, right? Like, oh my gosh, you know, I lost my modesty or I got over that a long time ago because so I went obviously through the healthcare system as a cancer patient like we just talked about, but if you go even further back, I was in a car wreck in high school, broke my back, was paralyzed from the waist down. And I was in the medical system for a long time where I couldn't, I did, and I was 18. I was 18 years old. So there was a lot of, I just remember being so embarrassed. Like I had a urinary catheter in, having people clean me up, because I couldn't go to the toilet to, have a bowel movement. Like just all those like massive indignities, especially for an 18-year-old's brain.
Yes. Yes. Oh my gosh. My uncle was 19 when he had a spinal cord injury. Yes. We don't think
Mortified.
about these things.
Yeah.
16 when I tore my ACL. I was like, you need me to what? Where? No.
Yeah.
No.
Yeah. Exactly. So, and it is important and how healthcare workers navigate that with you and treat you as you are going through whatever you're going through matters. It matters so, so much. And some people are great at it and some people aren't. And there are all sorts of reasons for that. And sometimes it's not the person, it's the system, and the pressures of the system. But yeah, I believe that probably is one of the most important things is that we help people maintain their dignity.
And I feel like to your point and to what you've gone through, I haven't personally gone through a cancer journey, so maybe I shouldn't speak to this. So please add in. But I feel like in a situation where you can feel like you have no control over so many things, that having somebody who can have KickIt pajamas or help you keep that sense of dignity and that little piece of control or who you were prior during this journey that may seem totally out of your control, that's so empowering.
No, you nailed that. And you don't have to have been, it's really not hard to imagine if you've been in the healthcare system
Mhm.
at any level. Even if it's, something joyful like delivering a child, right?
Yeah.
There's still like it is the small things that can really make a difference for your mental and emotional health. And that loss of control and that feeling like a patient, right? Like, and once you start feeling like a patient, they always do this thing, which again, I understand why this is not a criticism of this part of the process, but it does make you feel like really just a number. So they come in and you have to say, they scan your bracelet. You have to say your name, your birthday. And you're saying that every time any kind of healthcare worker comes in and that is for good safety reasons.
Right.
But a lot of times, these conversations feel rushed because they're very busy and in lots of different places. So add on to that horrible gown, that scratchy,
Yeah.
horrible, uncomfortable gown that just never feels right on your body no matter what, whether you have it untied in the back or whether you try to have it tied, whatever, it just never feels right on your body. And you feel just like a number,
Mhm.
right? You do not feel like this individual human being that has like an entire emotional world that's going on as you navigate this. And so small things like wearing your own clothing in the hospital makes a difference. And that was what I discovered in my cancer journey. So the whole reason how Kick It Pajamas started was I had a friend of mine who gave me a pair of PJs while I was in the hospital. And I couldn't believe how game changing it was for how I felt. And
Mhm.
the other thing was the medical staff noticed, and the problem with them was they didn't have the right functionality for easy access to care for me. But my
Mhm.
nurses were amazing. They were like, they saw Cindy
Mhm.
feels better in these, and they that mattered to them.
Oh yeah.
And
Oh.
so they were like, we're going to work around this.
Mhm.
Even though it wasn't ideal for them, they were happy to work around it because they saw how much it made me feel better. And that was when I realized that it matters. And then this isn't just a thought of mine. There are literal studies, there's research papers that are out there that talk about how this really helps patients
Mhm.
when they do wear their own clothing. There's a whole movement in Europe to have people during the day, people that are able to, right? If you're completely bedridden and you can't move, this might be a different story. But a lot of people in the hospital are mobile. I was mobile. I got up and did laps around the nurse's station. They
Oh,
encourage people to to put clothing on during the day.
oh
And
yeah.
then it can wear PJs and like literally like you would do in your regular life. And that
Oh
helps your
yeah.
mental health.
Absolutely. From a physical therapy, occupational cognitive therapy, speech
Yeah.
therapy place, absolutely. It changes your routine. It's like, oh, okay, I get up, I eat breakfast, I brush my teeth, I put my clothes on, and I get ready for the day. Even if I have to be in this situation for a bit, it changes the outlook. It's
Mm,
more normative. It
yeah.
allows you to be a little piece of yourself. And to know too, as a healthcare professional, how important that is to people and have the situational awareness to go, oh, thank goodness for that nursing staff to say,
Yeah.
okay, this is really good for her. Let's figure this out. And if you've ever been in a position as a listener here today in healthcare where you felt seen, it opens so many doors of
Mhm.
conversation and treatment options. So I love your mission. So tell us how those pajamas got to where you are today and all things Kick It Pajamas.
So I was diagnosed with cancer in 2004. And so that was when the idea came about. And then, but I had to, I went through chemo radiation and then I had to kind of recover from all that. So probably was around 2007, 2008 when I started to really put the idea together. So it just kind of incubated for a little
Mhm.
while. And then I started in earnest to do this, and I'm working as a veterinarian at this time. I know nothing about clothing or manufacturing or retail, like zero. And so I'm like, well, I could teach myself. And so I find a fashion school in Tampa, and I just emailed a bunch of instructors. And then finally, I had some that responded to me and said, yeah, we'll help you make a prototype. So they did. And then I kind of worked on it myself for probably like 4 years. I never got it launched, but I was just kind of doing it off and on and trying to just solo, bootstrapped all of
Mhm.
this stuff. And finally, I just was like, I don't know what I'm doing. Like, I'm having such a hard time figuring this out by myself. And I threw it in the closet. So fast forward, about a decade or a little less, my good friend who always loved the idea said, and she's a business person, she ended up serendipitously meeting these women who own a children's clothing company that were
Mhm.
kind of interested. And she said, hey, Cindy, can we pull this idea out of the closet? And I was like, sure. She's like, I think I have the right group of women together. So then Beth has her MBA. She's, an excellent business person. And then Parmalee and Anna, our other two co-founders, also excellent business people, entrepreneurs, and then understood e-commerce, manufacturing, clothing, the whole thing. So then we got this great team together. And the nice thing about the team is I'm the only cancer survivor, but Anna, our co-founder, she actually was a caregiver to both her parents right after she graduated college. Her mom had leukemia, her dad had pancreatic cancer at the same time.
Oh my
So
gosh.
for multiple years, she was their caregiver. And then she kind of postponed her, post-college adult life to care for her parents. And sadly, they passed about 5 months apart.
Oh
So
wow.
that was a big traumatic event, as anyone can imagine, to lose your parents at that age so close together. But she really comes at this with a caregiver's perspective, and she also has a degree in occupational therapy. So
Oh, there
yeah,
you go.
so she kind of also, so she's got that knowledge. She stopped doing that a while ago, but she brings some really great perspective to the team.
I love that. Well, and from a space where women treatments and research and things are kind of lagging, or
Hmm.
how many of us have been in a situation where we brought concerns to our healthcare professional and were dismissed on any level or another. Being able to be in a situation where women understand you, and let
Hmm.
me be clear, you don't have to be a woman to understand and have empathy for a woman. It's just taking that time and
Hmm.
having the care to do so. So tell us about the pajamas in particular. What is their purpose? How wonderful do they feel? All the things.
Yeah, so our first line was our hospital line. And so we have a gown and a pajama version. And the functionality is we've got the snap sleeve that goes all the way down. And the purpose for that, which I'd never thought of until I was in the hospital, and the nurses were having problem with my pajamas, is that the reason for those snaps on the hospital gown is to deconstruct that sleeve if you're hooked up to an IV. So
Mhm.
they can get you dressed and undressed, even if you're kind of hooked, you got a line that's going to a pole, right? Like, because
Yep.
otherwise you can't get a sleeve off over all of that.
Right. So
So
it's like
we,
the first course in PT school was lines, leads, and tubes. Like, don't pull anything out.
right. Yeah. And so having clothing that allows you to get around those lines, leads, and tubes, right, is important from the medical provider's perspective. We
Oh, yeah.
also have a front wrap design for backside modesty, but also for easy access for the team, so they can get the gown or the pajama top open quickly, can access if you've got ECG leads, if you've got surgical scars, whatever, you have easy access to that. We also have a pockets on both the outside, because in my opinion, every single piece of clothing should have pockets.
Yes,
And
absolutely.
then on pockets on the inside. So if you have surgical drains or other medical equipment that's close to your body, it can tuck into that pocket. And then it's not, um, it's less likely to pull or tug.
Mhm.
And then we also do kind of a wider sleeve. We do a little bit of a looser fit because sometimes, depending on the type of cancer you've had, you may have lymphedema, so swollen legs, swollen arms.
Mhm.
So we wanted to be able to accommodate, if women have that problem. On the pajama bottom, we call it a yoga waist. So it's uh, elastic free, so you don't have any of that pinchy elastic in it, but it's snug enough to stay up, but it folds, like you can fold it high up if you like a high waisted, you can fold it down because you may also have to consider surgical scars to where it's comfortable. So we tried to kind of think of all the different reasons. Um, you know, what I thought of was like, what are all the ways I was uncomfortable
Mhm.
in the hospital?
Mhm.
And then the fabric is a modal blend, which is moisture wicking, which is good, which really it's a great fabric for whether you're hot or you're cold,
Mhm.
because you can have, so I went through acute menopause and you will have temperature swings, and this can happen with chemo and radiation, having temperature swings. So the fabric, and then just being soft to your skin, because sometimes your skin is very sensitive. Radiation can actually burn you, and your skin over the places where you're irradiated can be very kind of, ouchy. And so having something super soft is nice. So those are just some of the features. And then we did a recovery pajama. So we decided we wanted to help take women from the hospital all the way to when you're out in your life, because cancer treatment sometimes can go on for years.
Oh, yeah.
And so you're sometimes going back to work, you're going to meetings, you're going to your child's graduation, you have life events to attend, and
Mhm.
sometimes you need functional clothing. So we
Mhm.
then went to a recovery pajama. We started making some items for if you're in an infusion center,
Mhm.
a tank top for a post-op tank top. And then we designed a dress that was actually based on a friend of Beth's, our CEO. A friend of hers was a two-time breast cancer survivor. And she told us one of her frustrations was she didn't have her daughter's graduation was coming up, and she still had her drains in post
Mhm.
mastectomy, and she didn't have anything to wear, and she
Mhm.
couldn't pull anything over her head.
Right.
So we designed this dress. We call it the Kristen dress, named after her, which has a front zip design. It's a two-way zipper. You don't have to pull it over your head. It has a
Mhm.
nice, pretty, flattering A-line, not
So
super
pretty.
fitted.
So pretty.
And then you can have the drains on the inside. So it's got inside pockets and outside pockets, and it's actually a super soft bamboo fabric. Um, so yeah, so that's our line right now.
Well, and I want to go back to the hospital for just a second. For somebody who's worked in pretty much all areas of healthcare, so much about this is awareness. So many of our listeners may have never known anybody who has had cancer or seen them in the hospital and what it truly is about, or may themselves not be in healthcare. So to think about lines and IVs taped to you and being connected to how many IV poles and, like you said, EKG leads, or like several of my patients and my mother had bilateral mastectomy. So you have these huge incisions, and to be able to be in the hospital, and like we said, back to that dignity piece earlier, to not have to get completely naked
Hmm.
and show off for every CNA, doctor, anesthesiologist, every person who walks by the door, because
Yeah.
a lot of times, let's just be clear, the curtain isn't closed, to be able to sit there and be able to have your incisions looked at, have your
Hmm.
IV port changed, all of these things happen, and you be in a comfortable fabric in a place of dignity where you're not totally out for the whole world to see, and be in a fabric that's comfortable against your skin when hospital beds and rooms in general are not made for comfort. They're made for your survival. That's
Yes.
really, they're made for access for your doctors and your nurses to get to everything that they need to get to quickly in the event that something bad happens. So I just want to put that a little bit into perspective for our audience, because this isn't just clothing, and I want to be incredibly clear. This is game changer for you, the friend who gave you pajamas, for my mom who could who I wish I had known about you so many years ago. Um, this is the ability to have a little piece of control and maintain your dignity in a space that can be very
Yes.
scary time of your life.
And I think the other thing that it helps solve for is the loved one, right? So, how many, like, sadly, most of us will either experience cancer or some other illness or surgery, or we will know someone who does. And most of the time, we're going to know multiple someones.
Right.
And so whenever something like that happens, you hear a loved one is diagnosed with cancer or something else, your first thought is, what can I do? Like, what
Right.
can I do for them? Like, and it depends like how close in proximity you are to them, whether you can like literally, go help, make a meal, do whatever, walk the dog, which are all amazing, wonderful things. But also, when we think of gifts, we often think of flowers is typically the first thing that comes to mind. And make no mistake, flowers are beautiful and they do brighten a room. But one
Mhm.
thing that many people don't know, and I didn't know this either until I went through it, is that in certain cases, cancer patients can't have flowers if they're too immune suppressed, and probably in some other disease states as well. If they're
Right.
too immune suppressed, they can't have flowers in their room. And the other thing is flowers are really fleeting. They're beautiful, but then, they're gone. And so at KickIt, we came up with something sort of stay away from, if you're thinking of gift giving, stay away from the F's and stick to the C's. So the F's are things like flowers, fragrance,
Mhm.
and food.
Yes.
And I am not saying patients do not need to be nourished, and making meals for the family or caregivers, and sometimes even for the patient, can be good. But things to be aware of about fragrance and food are fragrance. I remember I got this like whole kind of It was so sweet. It was this lovely like kind of bathroom set gift of like lotions and stuff like that that was lavender.
Hmm.
To this day, I cannot stand the smell of lavender because I associated with feeling nauseous from chemo because I
Yeah.
used it. I was like, oh,
Yeah.
this is so nice. And then it
Yeah.
became associated with feeling nauseated. So sometimes
And that
fragrance will
fragrances
work.
can be so triggering. And so often,
Yeah.
like, even if it's not the chemo, but just all the medications you're on in the hospital
Yes.
can cause nausea too.
Yeah, exactly. So fragrances should stay away from it this for an ill person. And also food, you have to be careful because the your taste is not the same. One, you may not be hungry, you may be nauseous, but also chemo changes your taste buds and you things do not taste normal. And so my favorite food pre-chemo was not my favorite food during chemo. They may have mouth sores. So food may not be the best gift either. So then if we say stick with the C's, the stick with the C's is comfort, right? And comfort can mean clothing and things like that. It can also mean just literally a comforting word. Like it means so much to someone just to say, I I love you. And I'm sorry you're going through this. You don't have to fix anything. You really can't fix anything. But just
Mhm.
knowing that people care,
Right.
right? So showing you care, which is another one of the C's, um, is can make a big, big difference.
Well, and something that I've heard from my patients over the years is just having somebody to ask them what they want, which
Mm-hmm.
again is them being able to be in control. Or if there was something I could do to help you, what would it be? Or
Mm-hmm.
or something that you want done, what would it be? And that gives you a little bit of space to be back in control of something and know that it's given being done. And knowing that your friends are there to help support you and know that they want to do what you need. And I think the other empowered piece that I've heard a lot of patients say over the years is, I wish I could just tell people to leave me alone. And I'm like,
Mm-hmm.
you can. You
Mm-hmm.
absolutely can. I appreciate your sentiment. I would really prefer not to have visitors. And if you don't feel like you're empowered enough to say that, tell your therapist, tell the nurses that walk in, tell your family member, tell somebody to say, I just don't want visitors right now. And that's okay because this journey is also yours. And
Mm-hmm.
it can mean so many different things for so many people.
Yeah, I love that you brought that up because that's so true. And maybe as a loved one or a caregiver, remembering to ask that question, like, hey,
Mhm.
would you like company right now or not? And if it's okay if you don't.
Mhm.
Another thing that is a little bit along those same lines that I remember experiencing is so there is a storyline out there that, if you're positive, right? Like stay positive, you can beat this thing. And if you're positive, you're going to help yourself. And I am not negating that idea. It does help, if you can find, some positivity in things that are going on. However, if you think about it another way, that puts an awful lot of pressure on that patient. And and it almost implies the alternative. If you're not, it's your fault, right? And that is a weird pressure to put on the patient. And I had these perfect, like yin and yang with my oncologist. So I had a medical oncologist and a radiation oncologist. My medical oncologist was unicorns and rainbows. His name was Dr. Prophet, which I thought was like like a good omen. And he was the nicest man in the world. But he was so positive that in some ways he didn't prepare me for some of the negative things that would happen to me. And it was the nurses who came in and were like, because they kind of knew him, they knew he was like that. And so they would, he was like, you're not going to lose your hair. You don't need any of this, like, because they were handing me the little pamphlets for the like scarves and stuff for your head. And the nurses were like, slid it back to me. And I did end up losing my hair
Mhm.
at the end of the day. But I guess some people do and some people don't with the type of chemo I was on. But then my radiation oncologist, he was the opposite. He was a great doctor. I have no doubt that his decision saved my life, but he was blunt, like
Mhm.
so blunt. And and when I would ask him questions about like, what would happen if this didn't work, he did not tiptoe. And
Mhm.
what he told, I mean, I was like, I know I just went pale and almost wanted to pass out when he told me what would happen if this came back. And I just, but he didn't mince words. He didn't, and then he didn't, you know, he just said it and then left. But
Mhm.
I know what I was going to say. But the one thing he said to me that was so meaningful, he said, and I think I was crying. I was like sobbing. And he said, Cindy, he said, cancer is going to do whatever it wants. If you're in a bad mood, you be in a bad mood. If you're sad, you cry. If you're happy, be happy. He said, it's not going to change the course of your disease, which maybe sounds harsh. And there'd be maybe a lot of people out there who would not like that. But what it did for me is it gave me a sense of freedom.
Mhm.
It gave me permission to go through the range of emotions and
Mhm.
not have to constantly like say, oh my gosh, I gotta be positive, I gotta be positive. Because if I'm not, I'm hurting myself.
Mhm.
And you worry about hurting your loved ones too, because I don't want my mom to be uncomfortable. I don't want my sister to be uncomfortable. So I'm gonna really put on a good face.
Mhm.
And that's a lot of pressure.
Mhm.
It's a lot of pressure. And so I really appreciated that message, because then what I discovered is that when I had that permission, then the silver linings came through more authentically.
Mhm.
And then I really, so the positives, and there were positives about this whole thing. I felt them genuinely. I wasn't forcing myself to feel them, if that makes sense.
Oh yeah, absolutely. Giving yourself grace through all the ranges of all the things is so important. And I remember my mom finally crying for the first time. And it was like months and months, maybe a year later. And I sat there and she was like, I'm sorry, I'm sorry. And I said, no, I am glad that you're feeling this because it's been shoved into a box for the
Mhm.
past however long. We have to feel things to move through them, whether
Yeah.
that's anger, fear, sadness, joy, any of the things. But like you said, the more quickly you allow yourself to feel whatever you're feeling, you can move through to the next phase. But you don't
Hmm.
have to on anyone else's time frame.
Hmm. Yes.
This is such a beautiful conversation. What has been the most rewarding piece of Kick It Pajamas for you?
I would say, honestly, it's our feedback from our customers. Like, if ever I feel sort of blue or frustrated, or, I mean, entrepreneurial life is hard.
Mhm.
And, I just go read our customer reviews, and
Mhm.
they are over the top. And I say to myself, like, I could almost cry saying this to you, because this is how like powerful it feels to me. I will feel like we're doing what we set out to do. We
Yeah.
wanted to give women dignity. We wanted to help caregivers and loved ones have something very meaningful to give. And we get that our reviews are more than like, oh yeah, they were really soft and nice. They're like,
Mhm.
thank you so much for, you know, thinking of this and helping me through such a hard time. Or thank you so much for um, giving me something to help my loved one through this.
Mhm.
Like one of my favorite ones, because I thought it was funny, and it was one of our very early ones. Because I don't, if anyone here listening is an entrepreneur, you'll totally get this. So, like when you're starting a company, and we work on Shopify, and you see your customers coming in, and there's four co-founders. So we would say, oh, do you know that person? Do you know that person? And the minute you start getting customers that aren't your cousin or your aunt or your friend or your friend's mom, like when you
Yes.
When you stop
Can you see the
recognizing,
ripple effect?
yeah, you're like, oh my gosh, these are like real, these aren't people who are just buying from us because they love us and they want to support. These are like
Right,
people out in the world that
right.
want our product. And so it was early days, but it was when we were starting to get like a real customer base. And this one woman wrote, and she said, these pajamas are so amazing and so soft. Like, I almost can't wait for my surgery. So, this was a woman who was planning for her surgery and she planned ahead and she bought, she was like, I am going to have this for surgery. And first of all, that was amazing to us because we hypothesized that the majority of our customers would be gift givers.
Mhm.
Not true. That is
Yeah,
not true. We're probably about 50-50. Patients are preparing for themselves.
yeah,
And I just, that just meant so much to me that, that realization that, you know what, you can actually also prepare for yourself.
yeah.
Um, and for your hospital stay or your recovery at home or whatever.
I love that. I want to know how people can get in touch with you. And I know our listeners are asking the same, like, how do I do this? How do I find her? How do I find these pajamas and clothing line? So how can our listeners find you guys?
So kickitpajamas.com is our website, and you can see our whole line of clothing there. We also sell on Etsy and Amazon, but we'd love it if you'd come direct to our website.
Right. Absolutely.
And then my email is Cindy at kickitpajamas.com, CINDY.
I love that. Is there anything else you'd like to say just as we wrap up today?
I guess I just want to say all of us are going to face the healthcare system at some point if you haven't already. And it is a beast to navigate as a patient or a loved one. But remember that you can advocate for your loved one and you can advocate for yourself. And the caregivers in the hospital, the people who work in the hospital, will actually appreciate it if you do that. Most of them are doing their very best in a very busy system that is not perfect.
Yes.
So be your own advocate.
Yes. Oh, I love this so much. Cindy, thank you for this conversation and really the courage it takes to turn your own story into this beautiful entrepreneurial journey of Kick It Pajamas, where, as Cindy said, it's more than clothing, it's dignity, it's beauty, and it's hope stitched into something women can actually feel. So, kickitpajamas.com, Cindy at kickitpajamas.com, and allow the women in your life or friends or family to feel strong and seen. Thank you for being on Empower Her Radio today.
Thank you for having me.
As we close out today's episode, I want to leave you with this. Your next level is already within you. If you're feeling that pull for more clarity, more alignment, and more courage to step fully into who you're meant to be, this is your invitation to take the next step. Whether you're an entrepreneur ready to scale or a woman standing at the edge of something bigger, the path forward starts with trusting your desires, owning your worth, and leading with your inner knowing. This is exactly what I offer. Private VIP coaching, and where I guide women inside the 10K Club and 50K Club through consulting with She Sells and Superhuman Selling to help you gain clarity, step into aligned action, and build a life and business that reflects your highest vision. If you're ready to explore what's next, let's have a conversation. Book a free call now at www.corywinn.com/free call. I can't wait to connect with you. Talk soon.